the best examples of protein processing that talks about lots of different types of protein processing that are important for the function of a molecule is in the synthesis of collagen. And so this whole section will be devoted to a discussion of collagen. Collagen is an example of a protein which undergoes extensive post-translational processing of many different kinds. Collagen is an extracellular structural protein. It's actually the most abundant protein found in the body. The function of collagen is to structure and order extracellular spaces, especially in connective tissue. But it's also what gives tendons and ligaments and bones their tensile strength, or the strength to resist stretching. Collagen, the function of collagen comes from its distinctive amino acid composition. Every third amino acid in collagen is a glycine, and about 20% of the amino acids are proline. And a lot of these prolines are hydroxylated post-translationally. That is, after the collagen molecule is translated, little hydroxyl groups are added to the proline amino acids. In addition to that, there are some lysine residues which are hydroxylated as well, and some are deaminated to form aldehydes. In the endoplasmic reticulum and in the Golgi apparatus, each of these collagen peptides forms a left-handed alpha helix. Now, what does it mean? What do we mean when we say left-handed alpha helix? I can explain it best by showing it with my hand. A left-handed alpha helix, if you stick your left thumb into the air, turns in the direction that my other fingers are pointing. That's a left-handed helix that twists in this direction. A right-handed helix, by contrast, is the direction that my fingers are pointing when my right thumb is sticking in the air. So a helix that winds this direction would be a right-handed helix. So each individual collagen peptide then forms a left-handed alpha helix. 3 of these left-handed alpha helices then wind around each other in a right-handed helix. And this triple helix, it's a helix of helices really, is the primary structural unit of collagen. Now the formation of these helices are dependent upon the unique amino acid structure of collagen. That is the arrangement of the glycine, the proline, and the hydroxyproline residues. Here's a picture which shows what this helix of helices looks like. On the very left you see the alpha helix of each individual proline, shown in 2 different forms. And then you see these 3 left-handed helices wound around each other in a right-handed helix, both from the side and from a top view. These triple helices are then secreted into the extracellular space, where they associate with each other or aggregate together into what we call collagen fibrils. These collagen fibrils are cross-linked to each other extracellularly, and this is a process which involves the formation of a covalent bond between deaminated lysine residues. Now, the cross-linking of these triple helices causes them to have increased strength. The fibrils then associate with each other then to form what we typically refer to as collagen fibers. The next slide shows a schematic of what this looks like. You start with the alpha helix, the single peptide. This forms the triple helix. The helix then forms a collagen molecule by forming fibrils which are cross-linked to each other, and then these fibrils associate with each other to form a collagen fiber. Now we want to review quickly what the primary, secondary, tertiary, and quaternary structure of collagen is. You remember in previous lectures we defined what each of these protein-protein interactions are. Collagen provides an excellent example of primary, secondary, tertiary, and quaternary structure, interactions between amino acids, both within and between peptide molecules. The primary structure of collagen has to do with its unique arrangement of glycines at every third position and the presence of hydroxyproline molecules in the primary sequence of the collagen molecule. Secondary interactions are interactions between individual amino acids within the collagen peptide, which allow it to wind into this alpha helical form. That's an example of secondary structure of collagen. There is no specific tertiary structure of collagen, but there is quaternary structure, in which these alpha helices form triple helices, so an example of peptide-peptide or protein-protein interactions, and then these triple helices are cross-linked to form collagen molecules to form fibrils and fibers. Now the formation of collagen can be defective, as shown in the following clinical vignette. A 9-month-old girl presents to the emergency room with a fractured left humerus and extensive bruising on her skin. The parents tell the doctors that the girl fell while trying to learn to walk. but several of the emergency room personnel suspect that this child is a victim of child abuse. When you do a physical exam, you notice that this is an otherwise healthy toddler, but she's very small. She's in the less than 10th percentile for her height. You notice that she has a deformed, swollen left upper extremity as a result of a humerus fracture, and she has extensive bruising throughout her body. In addition, you notice that she has very blue sclera in her eyes, she has thin, translucent skin, and she has hyperextensible joints. What is the disease that this patient has? This is an example of osteogenesis imperfecta. Osteogenesis imperfecta, or OI, is a disorder caused by mutations within one of the collagen genes, resulting either in decreased production of collagen peptides or structural abnormalities in the collagen molecule, leading to missense mutations in the glycine codons, which are so critical for the primary and secondary structure of collagen. Either way, the result of these mutations is abnormal, unstable type 1 collagen. Now, depending on the type of mutation, OI can exhibit either autosomal dominant or autosomal recessive inheritance. Why do you think that this disorder would be autosomal dominant? Well, the answer is because collagen forms a triple helix. A defect in one peptide can alter the structure of the helix, even if the other two peptides are normal. So even if you have a single allele which is producing normal peptides, the alleles from the defective peptide could affect their function, and so you only need a mutation in a single allele in most cases in order to have the phenotypic manifestations of this disease. Now, there are 4 different types of osteogenesis imperfecta. Type 1 is inherited in an autosomal dominant fashion, and it exhibits skeletal fragility leading to fractures, dental deformities, the teeth don't form properly. They have hearing impairment, and this is because of defective formation of the small bones of the middle ear. They have laxity in their joints because of defects in collagen deposition in tendons and ligaments. They have blue sclera because of defects in the extracellular substance of the sclera. Type 2 is autosomal dominant. A few are recessive, but is predominantly autosomal dominant. This is the most severe form of osteogenesis imperfecta, and in fact is usually lethal in the perinatal stage of life. In this, they have severe skeletal deformities, are easily fractured, and again, they have the blue sclera. Type 3 osteogenesis imperfecta is, again, predominantly autosomal dominant, but in about 25% of cases is autosomal recessive. This one is a little bit less severe, and it exhibits growth retardation, multiple fractures, kyphoscoliosis, or defects in the curvature of the spine. They may have blue sclera, but they may be white as well, hearing impairment, and dental deformities. The 4th type is autosomal dominant, and it is the least severe, with moderate skeletal fragility, short stature, and dental deformities which are variable to absent in individuals. There are other forms of collagen disorders. For example, Ehlers-Danlos syndrome is a similar disorder to osteogenesis imperfecta that's also caused by mutations in collagen. This is a very heterogeneous disease. It can affect several different types of collagen, not just type 1 collagen, with a variety of different clinical consequences. And because there are different genes that are defective in this disease, it can be either autosomal dominant, autosomal recessive, or X-linked recessive. Now, there can also be acquired collagen defects. An example of this is the nutritional defect that we refer to as scurvy. Scurvy is caused by a dietary vitamin C deficiency or ascorbic acid deficiency. Vitamin C, its major function in our bodies is that it's a required cofactor for the hydroxylation of proline and lysine residues in collagen. Without the hydroxyproline and hydroxylysine residues, collagen can't assume the proper structure or conformation, and so the collagen doesn't function properly. The clinical consequences of this is an acquired disorder of abnormal bone growth, thin skin, easy bruising, gum bleeding, and defective wound healing. All of these are a result of defective formation of collagen in somebody that doesn't consume enough vitamin C. This concludes the section on collagen.